Hi, my name is Ron Miller. I'm a medical malpractice lawyer at Miller & Zois. My law firm handles cases involving the failure to perform a C-section. A C-section or cesarean section is the surgical delivery of a baby through an incision in the mother's belly and uterus. A C-section is often necessary when a vaginal delivery would put the baby or the mother at risk. This may include obstructed labor, twin pregnancy, high blood pressure in the mother, breech birth, or problems with the placenta or the umbilical cord. The decision to perform a C-section is broken up into two basic categories: conditions that usually require a pre-planned C-section, and those that require a C-section because of fetal distress, either prior to labor and delivery or during labor and delivery. Conditions that require a pre-planned C-section include a baby in breech position with feet first, women with a prior history of a C-section, and prolonged labor where there's a failure to progress and dilate. Each of these conditions involves a scenario where the baby is not yet in fetal distress, but a C-section is warranted because of the known risk to the fetus if a C-section is not performed. In a mother experiencing any of these medical conditions, the standard of care is that a C-section must be performed. In other situations, a C-section is required because the baby is experiencing fetal distress, either prior to labor and delivery or during labor and delivery. Simply stated, fetal distress is when a baby is being deprived of oxygen and needs to be delivered immediately. The standard of care requires that an obstetrician immediately deliver that baby when it's in fetal distress. Conditions that cause fetal distress and a lack of oxygen include placental abruption, twin pregnancy, preeclampsia, diabetes, restricted growth, and a malfunction of the uterus and placenta. Sometimes the mere force of uterine contractions itself is enough to cause fetal distress. So how does an obstetrician know when they need to perform a C-section? The answer is often in the fetal monitoring strips. These strips monitor two things simultaneously: the mother's uterine contractions and the baby's heart rate. Oftentimes, the baby's heart rate moves in response to the uterine contractions. When the baby's heart rate goes up, it's called an acceleration. When the baby's heart rate goes down, it's called a deceleration. When these decelerations occur in response to a contraction, this will determine whether or not they're called late or variable decelerations. Both types of decelerations could mean the baby is suffering from fetal distress and a lack of oxygen. It is also important to see if the baby's heart rate is moving up and down when a contraction is not occurring. This is called variability. Minimal to no variability is often a sign of fetal distress. A normal fetal heart rate is between 110 and 160 beats per minute. A fetal heart rate above 160 can be concerning for fetal distress, and a fetal heart rate below 110 can also be a sign of a lack of oxygen. Ultimately, the fetal heart strips are how a baby communicates to a doctor. If the baby is in distress, the doctor will likely see minimal to no beat-to-beat variability, combined with late or variable decelerations. The doctor may also see a heart rate above 160 beats per minute or dropping below 110 beats per minute. These are all signs of a medical emergency requiring an immediate C-section. Because fetal heart strips are continuously recorded during labor and delivery, it's imperative that doctors and nurses pay careful attention to any changes in the fetal strip pattern. Any delay in responding to fetal distress and lack of oxygen could cause permanent and life-altering injuries to the child. If the child survives, he or she may be born with permanent neurological injuries, including the inability to walk, talk, eat, speak, and process information. Many of these children will never be able to live independently, enter the workforce, and they'll require lifelong medical support and medical care. I can't say it enough. Oftentimes these injuries could have been prevented by simply monitoring the child and performing a C-section. Our law firm handles failure to perform C-section cases. If you believe you have a case involving a failure to perform a C-section, again, my name is Ron Miller. call me today at 800-553-8082, and we can talk about your options for pursuing a potential claim. Thank you.